Hello, my name is Dr. Minniear-Corrons. I'm a board-certified family medicine physician here in Clarksville. I'm located right behind the hospital at Mercy Clinic Primary Care. In keeping with our series of talks on wellness, today's talk is going to be on smoking cessation. So this is obviously targeted for any current smoker of any age because smoking cessation at any age is associated with health benefits. So cigarette smoking is the leading preventable cause of death. It is a major cause of disease, including cardiovascular disease, which includes heart attacks and strokes, COPD, or what some know as emphysema, and lung cancer. Many are familiar with these because this is the leading cause of death among people who smoke. However, smoking is also associated with other cancers such as head and neck cancers, esophageal cancer, bladder cancer, and pancreatic cancer. In addition, there are other health conditions that increase with smokers, and that includes stomach ulcers, osteoporosis, and diabetes. Chances are that many of you listening to this talk today who currently smoke have attempted to quit smoking in the past and for one reason or another ended up relapsing. And I just want you to know that that's not uncommon and you're not alone in this. So hopefully today in this talk I can give you some tips so that when you attempt to quit next, it will help you be more successful. One of the biggest things that you can do to be more successful is get your primary care physician involved with you helping you quit smoking. This increases the likelihood that you will be successful just by having them involved at all. Once you've decided to quit smoking, the first step is to decide a quit date. This date should be within 2 weeks of deciding to quit smoking, and you need to write it down or put it somewhere that makes it somewhat official. Otherwise, what tends to happen is if you have an arbitrary date in mind, that date keeps getting pushed back for one reason or another. So get it in writing somewhere to where it will help you be held accountable. During that 2-week period of time, there's two things you can do. You can either slowly start weaning yourself off the cigarettes to help the withdrawal symptoms not to be as intense, or you can simply wait for that 2-week window and then just stop completely at the end of those 2 weeks. Next, you need to ask for help and support. Obviously, I mentioned already, getting your physician involved is a great resource. They can be, a coach, someone that you're held accountable to, and we have obviously medicines and things to help you get through the really difficult stages of smoking cessation, but also getting your family, friends, and coworkers involved with helping support you through this, especially those who have successfully quit smoking in the past. They may be able to offer you some tips that have been helpful for them. It may not work for you, and that's okay, but it's more resources, more tools for you to be using to help quit. It may also help you to have a list of reasons as to why you're quitting. Maybe it's financial. Cigarettes are very expensive and, they continue to increase in cost. So maybe your budget needs to be lightened a little bit, and that would be a great reason to quit smoking. Maybe it's for the health concerns that I already mentioned. Maybe you have COPD and you have really bad symptoms. Maybe that's a good motivator for you. And maybe the secondhand smoke exposure, maybe you're having a new baby or your child has asthma or something like that, and you are wanting to cut down on their exposure. Those are all great motivators. So keeping a list can kind of keep it in perspective for you why this is very important to you. So once you've decided to quit, you should start mentally preparing for what you're about to go through. For those of you who have attempted in the past, you know what I'm talking about when I say nicotine withdrawal symptoms. And this is not just the intense cravings that you get for nicotine. It is increased appetite, irritability, anxiety, difficulty sleeping, difficulty concentrating, depression. The good news is that these symptoms don't last forever. They typically peak at day 3 and they slowly decrease over the next 3 to 4 weeks. You can help manage these symptoms by using medications that can be prescribed by your physician or with nicotine replacement. The goal, of course, which is to slowly wean you off of the nicotine. When it comes to the intense cravings, know that those cravings only last a few minutes. So if you can find something to do in those few minutes to distract yourself from going and smoking, it could be going for a quick brisk walk or squeezing a stress ball. Get creative with it. Try to figure out ways that you can deal with the craving long enough for the craving, that intense craving, to pass. It's important to identify triggers that make you smoke and try to avoid them if possible. Obviously, I understand you can't avoid work, but if it's a social situation where you get with your buddies and you smoke, maybe attempt to avoid that sort of setting for a while, since that is going to have a higher possibility of relapsing in that situation. So the last thing we'll talk about is relapse. And as I mentioned before, it's very common to relapse because smoking is an addictive disease. It's common for people to attempt multiple times before they're successful. So don't get too discouraged. The more times you attempt to quit, the more likely the next time you will be to quit completely. You should count any time that you've quit smoking to be a success, and don't get discouraged from trying again down the road. The most common time for relapse to occur is in that first week when withdrawal symptoms are the most intense. So that's why it's important to have mentally prepared, because many times if you know that that's coming, you may not struggle as bad, or if you have the support groups that we already mentioned, they can help get you through that very critical week. So the last thing I'll do is leave you with these important statistics. 1 year after stopping smoking, the risk of dying from coronary heart disease, so a heart attack, is reduced by about 1/2, and it continues to decline over time. Cigarette smoking is responsible for almost 90% of lung cancers. So when you quit smoking, you reduce your risk of lung cancer within 5 years of stopping. And lastly, in regards to COPD, while much of the damage that has occurred in COPD is not reversible, you can prevent further damage, and many times your symptoms can improve, such as cough and sputum production can improve after you stop smoking. So if you're listening to this today, I highly encourage you, if you're ready to quit smoking, go talk to your primary care physician so that you have their support. You can talk through a very patient-centered, focused talk about what way is going to be the best for you. It is, a case-by-case, patient-to-patient basis on what medications would be used. So definitely reach out to them and find out what they can do to help you. Quitting smoking is one of the most important decisions that you can make for your overall health. So if you're needing a primary care physician, we are still taking patients at the Mercy Clinic Primary Care behind the hospital. Thank you.